Hi, my name is Sandra Barrington, and I'm Executive Director of Sierra Nevada Memorial Hospital Foundation. And today we are going to start the first in a series of Doc Talks, where we bring doctors to talk to you about what it's like being a physician in the community, what services are available local, and let's talk about what the future of healthcare is. And for our very first in the series of Doc Talks, I have a very special guest. This is Dr. Scott Neeley, who is the President and CEO of Sierra Nevada Memorial Hospital. And before he was an administrator, he was a physician. So, Dr. Neeley, welcome.
Thank you.
Thanks for being here.
I think I'm still a physician.
You're still a physician?
Yes.
Yes, you are.
I am an administrator, but yeah, I think I'm still a physician.
So what is your clinical trade? What did you go into medicine to be?
So I went into medicine, honestly, thinking I was going to be a neurosurgeon.
Oh, wow.
But I ended up being an internal medicine specialist, and I then subspecialized in pulmonary, that's lung disease, and critical care medicine. And critical care is the care of very severely ill patients who require care in the intensive care unit.
Oh, and what drew you to that type of medicine?
You know, being a medical student is a real sprint, especially in the last couple of years when you're doing rotation after rotation after rotation, and you're learning a tremendous amount on your feet during those last couple of years, but you're also deciding what you want to be when you grow up. And most medical students pick their specialty probably during those last 2 years, unless they've got their minds made up way ahead of time. And during those last 2 years, I experienced something that I think all of us are deeply impacted by in life, which is mentorship. And the physicians who I was working with on those medical school rotations, who were the most kind, who had the biggest hearts, who were the best physicians, were the ones who really influenced me the most. And I started to want to be like them. And, you know, that drew me to internal medicine. And it also drew me specifically to the intensive care unit. And, you know, the thing about the intensive care unit that I liked was taking care of those very acutely ill patients, being able to sort of right there in real time save somebody's life. It was also very procedural. You know, we did a lot of things with putting, you know, big lines and tubes and minor procedures and so forth with people. And I liked that aspect of medicine as well. So sort of the dramatic thing of getting a really, really sick person who we could do something for right away and sort of demonstrably save, you know, before our eyes. That influenced me enough. And again, going back to that whole mentorship thing, I just had some extraordinary physicians during that time in my life who were, you know, my role models and heroes. And, you know, many of those people, when I think of, you know, who I have most respected and wanted to be like in life, it still goes back to some of those physicians who were my supervisors during those kind of formative years.
Yeah, that's really important to have those mentors in your life
absolutely.
And people that inspire you.
Yes.
And I'm sure you've done that for many. But you also have a very impressive CV. Your resume is a mile long and has a lot of really impressive names on it, like Harvard and things like that. Tell us a little bit about your educational background that got you to where you are now.
Well, let's start with the most important thing. I'm a graduate of Canby Union High School in Canby, Oregon. And that's a small town. It used to be a really small town. When my family moved there when I was, I think, about 7 or 8 years old, it was a town of about 3,500.
Oh, wow.
I think it's closer to 25,000 or something like that
really
now
grew,
because it was a farming community and it's become a suburb of Portland.
Oh, okay.
And so that was, you know, my childhood, growing up in a really wonderful small town, working on farms, you know, basically being the son of a professional, but who was doing dentistry in a farming community.
Oh, wow.
And he was oftentimes paid in produce and livestock.
Gotta love small towns.
Yeah. So that's where I grew up. And then I did have the great fortune of being accepted to Harvard.
Wow.
Undergraduate, and I did my bachelor's degree there. Going to a really great school like that, having that opportunity just sort of, for me, it just seemed to open one door after another. I got a scholarship and was able to study in London for a couple of years after
London.
that. And then I went to Stanford Medical School here in California. From there, University of Chicago for training in internal medicine and pulmonary and critical care. It's a long road to become a physician.
It takes a long time to become
I
a
had
doctor.
a lot of stops in some incredible places. So I was having a great life all along, but also working very hard.
Mm-hmm. Well, great. Well, we're glad you ended up in Nevada City, Grass
So
Valley.
am I.
Yeah. So talk about that transition into leadership from being a clinician, being a physician, and then going into that leadership role. You were a chief medical officer down in Stockton at St. Joseph's and did a lot of other things around residency programs. And tell us what it's like transitioning from that direct patient care to now you're, the head honcho.
I started to make that transition fairly early in my career, but it was sort of a long, slow burn. I would say that the thing that sort of started the fire for me was an interest in better outcomes for patients and quality care.
Patient safety, I hear you talk about that a lot. We have a daily leadership huddle. We talk about patient safety. It's a big part of your push here at Sierra Nevada. Tell us a little bit about how you manage that from a leadership level and how that trickles down to the rest of the hospital.
Well, it's interesting because hospital leaders have not always been, chosen or promoted because of their passion for safety and quality. But life has changed a lot during my career. As I told you, that was sort of the start of the fire for me, and that happened really in the early 90s, where again, an important mentor made the case to me that if we want to get better outcomes for our patients, then the first thing that we have to do is not harm them. And that kind of blew my mind a little bit because that's not what my education had been like up to that point in time. And so I became very interested in the patient safety and quality movement in the 90s. But I wasn't getting a lot of traction because a lot of hospital leadership and a lot of hospital management at that time was all about just, getting the doctors to admit more patients to the hospital.
Right.
And the emphasis on patient safety and quality actually required a shift in the focus, not just of hospital leaders and administrators, but especially in the focus of physicians. We have made the transition from believing that quality was all about us individually doing a good job to quality being about us as teammates, as part of a team, ensuring that the patient has the best possible outcome in terms of quality and safety. And that requires more than just a good doctor. It requires an entire team. And so we at Sierra Nevada have adopted a methodology that's been out there for a while. It actually grew out of innovative leaders, many of them from the military and the nuclear power industry, using their expertise in preventing safety events, bad outcomes, and taking that expertise and applying it to healthcare. And I became a real student of that science about 10 or 12 years ago when I was working in Chicago in my first CMO job. That methodology is called high reliability organizing, or HRO.
I've heard that term a lot. That is a big part of Sierra Nevada's structure.
We are
culture.
disciples, yes. That's how we manage. That is, if you will, it's an operating system.
Okay.
A computer needs an operating system, right?
Yeah.
It's the instructions that tell it what to do.
Tells the team what to do.
Tells the team what to do.
Great.
Our operating system is high reliability organizing. And I became very interested in that approach about, as I said, sometime around 2009, I guess, when I was the chief medical officer and the director of an intensive care unit at a hospital in the suburbs of Chicago. It's a fantastic approach. It's an approach that we can all understand, and it's an approach that really has at its core the notion that every single member of the team makes a difference, and the observations, the ideas, the input of every single member of the team is important if you're going to get the best outcomes for patients.
Yeah.
And you probably have gone through some of that training yourself.
A little bit.
But we tell stories, for one thing. We tell stories about how a slip up at the loading dock can result in surgical instruments being cleansed with the wrong fluid, and then those instruments being used on patients who are ultimately harmed by that event. Hospitals are such incredibly complicated entities that, my phrase, I think, was lifted from like Tom Wolfe's The Right Stuff or something like that, but it can blow in any seam. Hospitals are incredibly complicated organizations, and every single patient that we take care of involves hundreds, if not thousands, of separate individual actions and operations.
There's so many people involved.
There's
the
so
care of
many
one,
people
it's not
involved.
Just doctor and nurses.
It's not just doctors and nurses. It's the pharmacist. It is the physical therapist. It is the person who is in charge of sanitation.
Yeah, cleaning your room.
Cleaning your room. It's more than cleaning a room in a hospital. It's making sure that people don't get infections.
Right.
And there are just so many hundreds and hundreds of operations for every single patient in a hospital that everybody has to be on board, part of the team, and to begin with, just paying attention, keeping your eyes open, making observations, and then we all listen to each other.
And everyone's accountable.
Everybody's accountable. One of our catchphrases is being accountable teammates.
Yes.
And so if I slip up here and you give me a little bit of a coaching, like, look at that camera, not that one, or something like that, I go, thanks for the cross-check.
Right. Thanks for coaching me.
I'm willing to be coached. I'm willing to coach you, and I'm willing to be coached. And that's part of the way that we get outstanding results.
And that creates a really positive culture.
Well, it's how people stay safe. If you get into a modern commercial airline cockpit these days, the pilot is very likely to first introduce himself because he's joining up with a team that he may not have even worked with before. And then he's going to say, listen, if anybody sees anything out of the ordinary, if you have a concern, bring it to me.
That's a really good analogy. That's really comparative to the healthcare industry.
Absolutely.
Yeah, I like that.
It's like we're creating an environment where we're listening to each other and everybody has a voice and everybody feels very confident in speaking up. So again, you go back to that environmental services worker. We listen to that person because they're in the rooms, they're with the patients, they see stuff. And when I talk to them, I say the same thing every time. Your voice matters, and you have a right to be listened to respectfully if you see something or have a question or want to bring something up. And so that's a very big part of what we're doing. And so it's about a set of tools that helps us to manage better, but it's also about building a culture where people feel free to speak up, where they're respectful to each other, where they value every member of the team, and that's how you get truly superior results.
That's so important. That's amazing. What a great way to organize such a huge structure. In the hospital is 104 beds. It has 800 employees, and to get 800 people all on the same page with the same system, I think that that is pretty amazing. And you've been CEO for about a year now. You're coming up on your 1 year.
I'm coming up.
What would you say of the last 12 months has been your biggest accomplishment to date as CEO of the hospital?
You know what? I got this question in advance.
You did?
I did.
Yeah, you did. He did.
I don't know what to say.
You don't know what to say. Well, you have some really great stats in patient safety. The number of days since a serious safety event is how many?
It is 305 today, so I'm glad you asked me that
305 days since a serious safety event.
Yeah.
That is a big accomplishment.
That in and of itself is,
right?
is
That's
a pretty
almost
good
a year.
one.
That's
a pretty
almost
good
a
one.
year. Yeah.
You know, whenever I report out about the hospital, you saw me report out at our board meeting last night.
Yeah.
I go through four things basically: safety, quality, the experience of the people that we care for, and our financials.
Yeah.
Those are the four buckets that are, you know, the thing that I talk about every single time. Okay. And so looking at, you know, my four buckets, I would say that I am most proud of the safety and quality of the work that we do at the hospital. And that extends to a number of different areas in our clinical operations. And so I would definitely place that as number one. But a close second is that, we're seeing through our means of gathering information, collecting data, and just listening to people in the community, we're seeing that people are noticing. They're noticing that the care is great. They write us letters.
I get those letters a lot of the time because a lot of the time those letters come with a donation back to the foundation, and people are grateful. They want to make a donation.
We're happy about that.
In honor of a physician or a team or a caregiver that's, they were really grateful. So we get those grateful patient letters, and so I see that.
And the survey data says the same thing. It has improved. And when I meet a new employee who's coming on board, I typically say, two things. The first is that the most important thing that we do here is to keep people safe and to deliver high quality care. And that means keeping our patients safe. It also means keeping our employees safe. It means making this a place where people are safe. Safety is an incredible concept, right? It talks to bodily harm. It also talks to psychological harm.
Correct.
And, healthcare is an area where there are ample opportunities for people to experience both because of the trauma, the stress of the situation. And so the second thing I tell them is over and above the technical quality of the care, we want that to be great, as close to perfect as possible. But we want people to also know that we are delivering that care with love.
And compassion.
Yeah.
Yes.
Yeah.
Definitely.
And, if we do that every single time, then the fourth area that I talked about, the financials, they're going to be fine.
Okay, good.
Because
is that the prediction for the future?
That's my
of
prediction.
Healthcare?
Exceptional care
Strong financials.
brings you success.
Great. Yeah.
People know this is the place to go. They bring their business there. They want to have their procedures, their surgeries, and so forth done there because they know that how they do with that experience matters to us.
Exactly.
It matters beyond just numbers and getting paid and et cetera. It is about delivering exceptional care to our neighbors, to the people that we live with in this community, and doing it with love.
Oh, that's great. Well, we're so lucky to have a nonprofit community hospital in our rural community, in our backyard. So one last question for you.
Yeah.
What would you see as the future for Sierra Nevada? The future of healthcare in a rural community like ours?
Well, what I would see is that we've got to get out of the winter and into the spring.
Yeah.
I think it's winter right now.
Winter is hard around here, yes.
Winter is tough in healthcare. Healthcare's under a lot of pressure right now. It's short days, less sunlight, kind of cold. It's winter. There's a lot of forces in society and the economy that are making it tough tough for institutions like us to thrive. In some cases, it's making it tough for institutions like ours to survive, period. I think we need to be very thoughtful in terms of planning how we use our resources. I think that we have to be, very nimble, always keeping that mission in mind. We're here to serve people.
Exactly.
We don't judge our success by our bottom line. We're here to serve, but we have to be successful in terms of that bottom line in order to keep the lights on, keep the doors open, and to continue to reinvest in the facility so that we have the capacity to deliver the care that's needed for people. So it has to be thoughtful, innovative, mission-based. And I think that we're really going to have to, in some ways, be futurists and think about how things like, for example, artificial intelligence is going to impact the practice of medicine, how it's going to impact the job of the physician working either in the community or in the hospital. It's going to change things a tremendous amount. I was reading an article the other day about an artificial intelligence platform that can very easily pass the medical boards that I took.
Oh, wow.
And guess what? I thought those were pretty hard.
Yeah, it's like a day. It's a day.
Yeah, it's like a whole day. Yeah, but the AI machine, I guess, used about 5 minutes.
Wow. That's interesting to think of moving forward.
It's powerful, and we can't be caught unawares as these changes come in. So I think that we're going to be here serving this community for a very long time.
Definitely.
And I think that it's going to take a lot of ingenuity and determination to continue to deliver on that mission. And I think that, spring is going to come and we're going to see a thaw, and we'll go through a period of time where we, are able to, lay out in the sun and take a swim. But right now it's a lot of hard work.
It is, and you do work very hard. And I want to thank Dr. Neeley for joining us today, the CEO and President of Sierra Nevada Memorial Hospital Foundation. This is Doc Talks. I'm Sandra Barrington, Executive Director of Sierra Nevada Memorial Hospital Foundation, and we look forward to seeing you for our next Doc Talk with other physicians in our community.